Okay. Which of the following findings is most likely to be seen on her MRI? We've got infarction in the left occipital lobe, infarction in the right occipital lobe, lesion in the left optic nerve, lesion in the right optic nerve, and lesion in the left optic tract. Okay, we've got a 50-year-old woman with a history of hypertension and hyperlipidemia presents to the clinic with a sudden onset difficulty seeing objects on the right side of her visual field in both eyes. She denies any headache, pain, or discharge from her eyes. Visual acuity is normal, and the fundoscopic exam is unremarkable. Pupillary light reflexes and extraocular movements are also normal, and then they perform the brain MRI. Okay, so because the visual acuity is normal, and because she has the history of hypertension, and the fact that she's 50 and not like 30, makes me not want to pick any of the lesions in the left and the optic nerves or in the optic tract.
Okay.
It just doesn't really quite fit the picture. Um, so now we've got to decide if it's the left or right. I'm pretty sure it is contralateral, so I'm gonna go with infarction in the left occipital lobe.
Final answer.
Yeah.
Good. Yeah, great. You're working through these really, really good. Okay. Um, so yeah, for sure, right? It's gonna be the contralateral. So, but just remember the lesion of the left optic tract can also cause right homeopsia, hemiopsia, similar to the left occipital lobe lesion. However, right, hypertension and hyperlipidemia, you're more likely to get like infarction rather than isolated lesion in the left optic tract. So just remember that. I wanted you to know that because
Okay.
the tract itself is different than the nerve itself, right? If you have a lesion in the nerve, it just knocks out that eye, right? If you have a lesion of the optic tract on it, it will have a visual defects bilaterally on the opposite contralateral side. Okay.
Okay. Got it.